A recovering alcoholic says he's had close friends die because there wasn't a place available for them in a detox or rehab clinic. They were told to wait weeks or even months but didn't make it. Andrew Wild and everyone else we've spoken to in the addiction and mental health sector say there needs to be beds available always, because one of the biggest hurdles in treating addiction is overcoming denial. The acceptance that, yes, I have a problem. Once someone gets to that point, they need help, and quickly. But currently, if you try to check in at a public detox or rehab clinic, you'll likely face a month-long wait. And as Andrew told Zach Fleming, sometimes the people who you're asking for help from, like CADS or the Community Alcohol and Drug Service, for example, tell you to keep drinking.
When 29-year-old Andrew Wild finally accepted he had a problem and needed help, one of the biggest hurdles to overcome as an alcoholic, the public health system wasn't there for him.
CADS has turned around and told me once to use controlled drinking. That, sorry, we don't have space for a detox. You have to maintain your drinking until we have space. To tell that to an alcoholic or an addict to keep drinking or keep using, that could kill you.
Which is exactly what his mum Ellie was terrified of.
It's a fear as a mother that you're going to lose your child, because it's just such a desperate time. And any addict or any alcoholic, anybody in need, the care will only work if they ask for help. And both those times Andrew has desperately asked for help. And once you do that, it's getting the care you need. But on both occasions we've had to get him into a private facility because there was just nothing available.
The most recent time was late last year.
We tried to get him into a detox unit, and it started in November. The earliest availability was March. Their hands are tied. The funding's been cut. There's no staff, there's no beds, there's just nothing available. It's our sick healthcare system.
So Andrew, wanting help, recognising he needed help, was facing a potential 3-month-long wait. That was at the Kennedy Detox Unit in Christchurch. Andrew is from Wanaka. The current wait there is 4 weeks, and Kennedy disputes it was 12 in November. It says it was 3, but won't discuss specific cases. Regardless though, if an addict or alcoholic wanted to check in today, they'd have to wait another month because there's no space. CADS, who Andrew says told him to use controlled drinking, confirmed to Checkpoint in a statement that sometimes they do tell alcoholics to do just that while they're waiting for treatment. Because for severely dependent people, withdrawals can result in seizures, hallucinations, or sometimes even death. So people who are that addicted are still told that they have to wait for treatment. Andrew was 22 when he first acknowledged he had a problem.
There's a lot of blanks that I still can't fill in, but for me it would have been probably the end of a week-long bender, what I'd call it. For alcoholics and addicts, it starts off socially. It might have started off at a party, might have started off, I don't know, at a gig, something like that. But we're not the ones that can stop on the Sunday or the Monday. And it turns, it keeps going.
His dad found him passed out in his car. The police had called him because someone thought the car had been stolen and dumped.
I remember Mum walking in just saying, "Do you want help?" And all I could manage out was yes.
So he got help, privately, because he didn't feel like he could wait. Andrew knows he's privileged.
And I'm just so lucky and so grateful that I had the means.
But what if he didn't have the money for private? He says he might not be here. He tells me he's lost friends who have died while waiting for help from addiction services.
Personal close friends I would have lost 5 to 10 from purely just because they had to wait. They had to wait for help. Whether it's through overdose, whether it's through suicide. It's one of the most important things possible. I mean, if you're at that breaking point, you need help, you want help, that's the hardest thing for an addict, is to first admit that they need help. If you've got to that point, that's when you need to be, you need to get in the doors of these treatment centres.
The government's inquiry into mental health and addiction services will aim to stop those unnecessary deaths and try to prevent addictions developing. The Health Minister David Clark wouldn't comment for the story because he didn't want to preempt the inquiry, which is in its early stages. But here's what he told Checkpoint late last year after listening to the story of Natasha Sadler, whose son Memphis died because, like some of Andrew's friends, he couldn't afford to go private.
I think most New Zealanders accept that we are not doing well enough. We've had a 60% increase in people putting themselves forward for support with mental health and addictions over the past decade, and yet funding has gone up by less than half of that.
Roger Green, the founder of The Retreat in Auckland, a recovery clinic based on the 12 steps of Alcoholics Anonymous, says that's largely down to addiction not being understood. I asked him how public addiction services in New Zealand have changed in the nearly 2 decades he's been involved.
Not progressed at all. Not progressed.
The Retreat has 30 beds, 25 for primary recovery and 5 for sober living, for people who have gone through the $10,000 month-long program but don't feel ready to leave yet. And if you're thinking that $10,000 for a month is expensive, it's actually around half the price of most private care facilities. The Turning Point in Auckland is $25,000 for a month. Capri in Auckland is $24,000 for 3 weeks. So it's not surprising then that most people turn to the public healthcare system. Like most medical issues, the best way to treat addiction is debatable. But Andrew, Ali and Roger all say that however it's treated, it needs to start being approached like it's a life-threatening disease.
There's also a feeling that, an addict or an alcoholic has only themselves to blame, when in fact they've got an illness which they'll die from. It's a fatal illness and it's progressive. It gets away from you. It's a disease that seems to want to continue on in the person. The individual wants to continue in the disease.
You may as well take a cancer drug off a patient and say, well, wait for another 6 months before we can give you something else. It doesn't work like that. This is a chronic disease. And I think there needs to be more education about that too, that it's not a person's choice, it is a disease. And that disease can be helped by getting them the good care.
There's been an amazing push for recognition around depression, things like that, other mental illnesses. People don't see addiction and alcoholism as a mental illness.
The Drug Foundation estimates around 150,000 New Zealanders need help with a drug or alcohol addiction, whether they realise it or not. Roger, who's 38 years sober, believes with enough money and the right approach, they can all be helped.
I'm not tempted when I see alcohol at all, or people around me who can drink. The fact is that it's in the understanding that has happened. I understand that it'll kill me.
Andrew's now gone 86 days without a drink. Like every recovering addict, he's hoping he can add to that number day by day.
I'm lucky enough to have that life, sort of as they explain it, beyond your wildest dreams, but I haven't been able to enjoy it. So I'm ready to go back and enjoy that life.
For Checkpoint, Zach Fleming.